Welcome back. We are answering your questions about the coronavirus with Cone Health's Director of Pharmacy and Oncology, Dr. Andre Harvin. You can text your questions to 336-379-5775. You can see the number at the bottom of your screen. This first question says, if you're allergic to the flu shot, should you get the COVID vaccine?
Yeah, that's a great question, and actually we hear it a lot. So if you are allergic to the flu vaccine, a lot of times it has to do with an egg allergy, which is very different from what we're seeing with any kind of reaction with this COVID-19 vaccine. So it's a good thing for you to talk to your primary care provider about, so you have a really good understanding of what that allergy is. But for the most part, we're still recommending that persons, unless you have severe allergies that have a certain mediation, and again, that's something that your PCP can help make sure you understand what it is. We're still recommending that everyone does the COVID-19 vaccine.
Mm-hmm. This next question says, do you anticipate more vaccines to be sent out in future shipments?
Yes. So we are constantly receiving new shipments every single week. So we have a commitment at the state level and at the federal level, and we anticipate we will continue ramping up as manufacturers continue ramping up their processes. When we look at both Pfizer and Moderna, and then Johnson & Johnson eventually entering the market, we absolutely anticipate that we will continue getting more and more of the vaccine as time goes on.
All right, this is a mask question, and the question is double masking a requirement or is it just encouraged?
I would say it's highly encouraged. And so I wear a double mask if I go into a grocery store where it's just, there may be some people that don't necessarily adhere to the 6 feet, especially when you see it at the checkout line. I'll go ahead, even though I am fully vaccinated, put on 2 masks. What you want to do is have maybe a surgical mask with your cloth mask on top. You can do 2 of the cloth masks, 2 of the surgical masks. Again, not something that's required, but something that's just highly encouraged, just to make sure that you're protecting yourselves and your community.
This question is, can you get an appointment wait list even if all the appointments are filled up?
Yeah, so you can get on the wait list for Cone Health. You just go on our website. So it'll be conehealth.com/vaccine or /COVID-19. And you'll find our way to our wait list. You can go ahead and put yourself on the wait list at that point in time. As more appointments are available, we can start to schedule you at that point in time. Right now, we're doing it a week at a time to make sure that we have enough allocation of the vaccine to meet demands. But that's really the best pathway for you right now. Now, you need to be eligible, so you need to make sure that you're in that 65 and up category as it stands right now. And again, keep your eye out for when we switch to the next group, where we'll allow more people, more frontline workers to get that vaccine. But getting on the wait list is great. It helps you get signed up. And then that way, when you're ready to go, you're going to get one of the first appointment slots available.
This question says, with the second Pfizer dose, lots of people report more noticeable side effects like headache and body aches and chills. Can I take ibuprofen to help with those side effects?
Yeah, so this is something I'll say there's a little bit of contention here around it. What most experts will tell you is actually you probably should not take something like an NSAID like ibuprofen prior to getting that vaccine, and I agree with that recommendation. One of the biggest things that we know based on how the vaccine works is that taking that prior could actually prevent the body from producing the right response to the vaccine. So you want to make sure that you get that high efficacy rate, get up in there into that 95th percentile. And so ibuprofen and other NSAIDs could stunt that. So yes, there are some additional side effects with that second vaccine. I'll be honest, I did not have it. I had more side effects with my first one. But hydration seems to be something that we like to recommend, and it has helped out. And again, these side effects are very temporary. So they last about 24 hours, 48 hours the most, and then they're gone.
So I noticed that you said don't take ibuprofen prior, but after you get the vaccine, if then you develop the fever, chills, body aches, can you take the ibuprofen then?
Even then, we want to make sure that the body is going through the natural response that it needs to get that immune response. And so again, this is an area where I'll be honest, I've heard some conflicting points on it. One of the last I read was a recommendation not to take it before or afterwards. Again, if you can get through that about 24 to 48 hour period of time without needing them, you can. If you feel like, hey, it's just too much, it's a little bit overwhelming, then absolutely you can take it at that point in time. What we're looking for when you're feeling those side effects, that is the vaccine going to work. It's actually forcing your body to have an immune response so that you're ready if the virus finds its way into your system. And so anything that prevents that body's normal response is going to prevent the efficacy of the vaccine itself. And so I will admit that I did take a little bit of ibuprofen because I had a really bad headache. And again, we learned over time as I was in one of the first groups that it's really probably best if I hadn't have taken that. But again, after my second one, I didn't have any issues, so I did not take anything before or after.
All right, good to know. Not prior and not afterwards. All right, you can continue to text your questions. We're going to be right back and take a quick break.